Is there anything else from your sort of side of view to the birth that woman can do to prepare herself for giving birth, for the labor?
Mm-hmm. Like from the physiotherapist point of view, well, I always suggest first of all to women to go and educate themselves on the topic, way in advance before they give birth. But one thing I like to mention, and I do mention, is the preparation of a perineal area. So basically the area where the baby will come out for birth. There are several ways that let's say, it's done and it's marketed. First one is a perineal massage. Basically it's a massage where you use a special oil. Most of the times it's just natural oil, such as olive oil. And with your digit, with your finger, you massage the area and you stretch the skin. There is no major research that shows that this will make a huge difference, but if things are done, properly, clean hands and everything, it's not harmful. It's also, I need to mention that accustoms woman of touching her body, which will prepare her later on for a possible self-scar release that I teach after birth, if necessary, if it's going to be necessary. So she's accustomed to it. Also, there are things that they advertise to prepare your pelvic floor. You insert them, you inflate them, and they supposedly stretch. Again, research is not so definite about it. Plus, it's finding times, wash everything properly, insert, do it, and so on and so on. And maybe somebody who is not indicated to have a sexual intercourse, that means the woman cannot insert anything in the vagina in general. So perineal massage is kind of a safer way. Also, there is a way you can open up those bones, open up those muscles, stretch them out, release them, get used to them. And I will show you this in a couple of exercises, very simple ones that you can do at home. But before, I would like to mention one thing. There is emerging research saying that your glottis, your kind of neck area, is connected to your perineum. So we need to relax the perineum for letting baby to come out smoothly, hopefully avoiding any major traumas to the pelvic floor. And therefore, it's good to prepare for a woman to be aware of her jaw and of her mouth during the pushing stage, or maybe to tell it to somebody who will be with her in birth, to give her a little reminder, relax your jaw. Make those very low sounds that will help to open up your glottis, and not the shouting, the squeaky ones that will close it up and that will close up your perineum. So this can aid as well, a little trick for you. Won't harm.
That's great, really.
In this video, I will talk and show you about how to prepare your perineal area for birth of the baby, for pushing, to make it a little bit more open, more elastic, to be more aware of it. So first of all, the very simple stretch that you can do, especially if you have a long-standing or sitting job, is 4-point kneeling. And here, think about your pelvic floor as a ring, and you want to lean back and stick your bottom out as much as possible. And stay in this position, relax your belly, and gently breathe. Then you can come out from this position and breathe out, and you can go lower. You can go as low as your belly allows you, but remember to keep your tailbone out, all right? You don't need to tuck it in. We need to open and to keep it out. You can do these stretches several times a day, 10-15 repetitions in the end of long sitting day. They're great. Also, there are a few special stretches I like to show to my moms to be more aware of pelvic floor area and also to be able to relax it. Many people talk about you need to use a pelvic floor, you need to train your pelvic floor, but in birth, it's also, and not only in birth, but especially in birth, and it's also important to be able to relax and release, because this will help you to push the baby out, to come for baby out easier, and also to try to minimize the trauma to the pelvic floor. So I will use two props. One is this special ball, like a small peanut ball. But if you don't have it, don't worry about that. You can use a rolled towel. And you put it right in between your legs, on your perineal area, and you sit on it. Okay? You will feel that it's pressing in, and it depends how soft or hard is your towel. If it's a little bit softer, it's actually easier. The ball is really nice and soft. If you feel it's a bit hard, you can lean back slightly on your hands, but just feel it pressing gently in your pelvic floor. And here, try to relax as much as possible and feel your pelvic floor dropping into that towel. So think about dropping, releasing, releasing more, and releasing even more. If this is too much pressure with the legs straight, of course you can vary it to crossed legs. If you have a good hip mobility, you don't suffer from pubic symphysis, because the next one is not great if you suffer from pubic symphysis. You can even go here, or it's better also with the ball, but it's like for really flexible moms. Now, if going on the floor is maybe not an option for you, or you have a big ball, that can work great. I'll take the big exercise ball, and again here, it's all about awareness. You sit on the ball, and you really need to feel that your perineal area is making contact with the ball. You release your tummy, then you make a breathe in, relax. On the breath out, do not contract. We're not doing Kegel exercise now. We're trying to relax and be aware of our pelvic floor, and try to relax even more and more. So I always say relax 3 times, especially when I work with women. When I prompt them to relax, and then I ask them, can you relax a little bit more? And a little bit more, there is always more relaxation available. And after you relaxed, you're aware of your pelvic floor being nice and open, you can make circles here as well, which will aid also your back pain. I hope it helps.